I take this time to reflect with my colleagues that we celebrate today the one-year anniversary of the passage of the Affordable Care Act, and to reflect on how much has happened to improve health care in America since the passage of the Affordable Care Act. And we have reason to celebrate. If you are a senior in the Medicare program, and you now know that you can see your doctor, your primary care doctor, every year for an annual wellness exam, and that wellness exam will now be covered under Medicare. So you have an opportunity to meet with your doctor and take charge of your own health. You have a reason to celebrate the passage of the Affordable Care Act. If you're a senior that happens to fall within the coverage gap under the prescription drug benefits in Medicare, the so-called donut hole, and you've been forced at times to leave prescriptions on the counter at the drugstore because you couldn't afford to pay the cost of the prescriptions, and you now know that there is coverage in Medicare if you fall within that gap. For last year, seniors, 3.2 million of them who fell within the gap received a $250 check. This year, the seniors that fall within this coverage gap will receive a 50% discount on their brand name drugs. Next year, their benefit will be worth as much as $2,400. And by 2020, we will close the gap entirely. All as a result of the passage of the Affordable Care Act. You have reason to celebrate that Congress finally got the job done. And if you are an American family, like many, and you celebrate your child's graduation from college, only to find out that your child could no longer be covered under your health insurance policy because of the age restrictions, and now you learn that Congress has changed that age to 26 so that you can keep your youngster under your family insurance program, and that child now has health insurance, and you're one of 1.2 million people who benefit from this provision that was in the Affordable Care Act. You have reason to celebrate the passage of the Affordable Care Act. Or, Madam President, if you are a small business owner who can now afford to cover your employees because of the small business tax credit that was included in the Affordable Care Act, 4 million eligible institutions will be eligible for that tax credit. And soon you'll be able to get competitive rates. Small businesses today pay 20% more for the same coverage as large companies. But Congress took action last year to eliminate that disparity. If you are one of those small business owners who are now benefiting from that tax credit, or who will benefit from more competitive rates and better choice, you have reason to celebrate the passage of the Affordable Care Act.